Hi, and welcome to Women's Health Conversations. I'm Denise Louie, and with me today is the founder of Women's Health Conversations, Dr. Vonda Wright, who has started a series called the Smart Savvy Speaker Series. And also with us today is a special guest, Dr. Sasha Shillcutt. And I will allow Vonda and Sasha to talk a little more deeply, but in the meantime, please know this is a recorded session, and if you have questions for either of the doctors, please tee them up in either the chat section or the QA section of Zoom, and we will tee those up for them. And I will see you all in just a moment. Thank you.
So thanks so much, Denise. And Sasha, thank you so much for being here today. I want to tell people more about you. And as we progress through this half an hour of conversation, I know they're going to be so thankful for the work you've done, maybe professionally, but most of all, anesthesiology, but most of all, they're going to be so thankful that you put it all together in this book we're going to talk about. But Dr. Sasha Shillcutt is by trade, as we say, an anesthesiologist, and not only an anesthesiologist, but a cardiac anesthesiologist. So she's truly the person who saves your life or is capable of saving your life at any moment. And she's been able to progress through the academic ranks and is a professor and a researcher and an author within academia, but now also, and probably for quite a few years, although I've become familiar with her work over the last year, a real leader within B2C, if you will, woman to woman, sharing the experiences she's had, not only being an academic, a physician, but a mother of 4 children, an entrepreneur, a speaker. And so there's so much that I can't wait to talk to you about today, Sasha. So thanks for taking this time with us.
Well, thanks for having me, Dr. Wright. I'm obviously a huge fan of you and your work and all of the things that you're doing to promote women and to promote women's health. I think it's amazing. And we were talking before the show we started recording that I see you as a unicorn because there's so few women in orthopedic surgery, and then to not just survive but thrive and be a woman in a very male dominated field, 94% men, but also have enough energy and time and passion to help other women is incredible. So I love talking to powerful women, and I love learning from powerful women like you. So thank you. It's an honor to be here.
Thank you thanks for saying those things. You know, when I first saw that you were coming out with a book and that it was called Between Grit and Grace, and so everyone listening tonight is we're going to just draw randomly and someone's going to get one. When I first saw the title Between Grit and Grace, I didn't get it initially because I just saw the title. But then I saw The Art of Being Feminine and Formidable. And I'm like, oh my God, that's right. Because I can tell you, you just quoted my stats, and I can tell you, I have tried everything. Meaning, I am from a farm in Kansas, and I used to be really, really sweet and nice. And then I go through this 22-year training period, and I used to say things like, well, not quite so nice as I was. And you just get war weary. I think you even use that word, war weary. And then I would try all kinds of techniques like, do I just be really nice to everybody to get my way? Or do I just be direct because I've become very direct to get my way? And then I read books like, I don't know if you've ever read this, but 10 years ago, I read this book by Charlotte Beers she was one of the first women in marketing. And she said, you got to be nice all the time. And I ended up being so confused because I know who I am inside. And I know I learned what it took to be successful in the business of medicine. And then I promise I'm getting to the point, and then I want you to really tell me how you got where you were. And then I heard Brene Brown say, you got to be authentic. And I said, what does authentic mean? And how do I be that when I've got to be nicer than I really am? And I'm tired. And Sasha, you have figured this out. So you went through a journey. I mean, if there's anybody listening, they're going, oh my God, that's right. How did you get to this journey? How did you figure it out? And let's just start there.
Well, I love that you just described like the first 10 years of my career as your own. You know, the thing is that I very early in my career figured out that the way that I got to medical school and the way that I achieved to get to medical school was not going to be the way that I was successful through my career. So as women and as girls, when we're younger, we earn gold stars, we're obedient, we wait to raise our hand to speak. And all of that feedback comes to us as very positive. And that's how we get good grades. Mm-hmm. That's how we get picked to be the superstar. And that's how we get into medicine, mm-hmm. or law or business or whatever it is that we're trying to achieve. But then once we get into the working environment, all of those traits, waiting, being obedient, waiting to be called on, don't mean anything. I mean, it doesn't really help you. And I found that there was a dichotomy, and like you, I felt like I didn't even know who I was at times, because I would try to be really nice to get what I needed to lead, which is what men do, and it would backfire. Or then I would get really stern or affirmative or assertive to get what I needed to lead, and that would backfire. And it seemed like whatever I was doing was backfiring. And in the middle of that was me, was the natural response, was the way that I would lead as a woman, but it got very obscure. And what happened was I became very successful by leading not as Sasha, by leading as men. I would follow this man and go, oh, I want to be like him. He leads this way. And I found success doing that in my workplace at times, but in my personal and professional or personal life, I was like totally isolated as a woman. Mm-hmm. I was burned out. Mm-hmm. I never felt like I could truly be me. I could never talk about like, oh, I'm going to go get a manicure or pedicure, because then I wasn't the serious scientist. Mm-hmm. I couldn't express my femininity in a way because it was like contradictory to my assertiveness. So it was so confusing for me that I actually got to the lowest point in my career about 6 or 7 years ago, and I wanted to quit medicine. I could not figure out how to lead as me and how to be me and lead and be successful that way. And so I read pretty much for a year, like every self-help book, all the books that you just are talking about, and they gave me personality whiplash. Like one would tell me, you got to lean in, and one would tell me, don't lean in too far, you'll get your head cut off, like all of this stuff. And I was like, this is ridiculous. The tightrope that women have to walk to be this perfect mix of feminine and strong and, assertive, but not too assertive. It's just insane. So that's when I thought, if I'm going to experience backlash for being who I really am, or if I'm going to experience backlash for being strong or soft, I might as well experience it for being who I truly am, right? Yeah. Like, yeah. Because if you survey women, if you survey the women that are really assertive, they experience backlash. If you survey women that are more collaborators, they experience backlash. So why would we not just be who we are? So when I pitched the book idea, like I thought, I don't know a woman on the planet that at some point doesn't require grit to get what she needs. Yeah. But also who doesn't need grace. And so when I pitched the book, everyone was like, well, you got to pick one or the other. You can't be both. And I'm like, no, that's the whole problem. We are both of those things. And we should allow ourselves to be both of those things, because we're women. We're never going to lead like men. And that's good. It's a good thing to have a woman leader who leads as a woman authentically as herself. So that's a very short summary of kind of how I got to where I was.
But in the description of that, in addition to all the wisdom of really affirming, yeah, it's real in your head. It's this shoulder. It's the guy on this. It's the gal on this shoulder. It's the gal on this shoulder. What you said is a ton of work, and it's you have to even be brave, strong, and courageous. Sometimes is how I like. Have I not commanded you, be strong and courageous? That's where it comes from for me. And I know that you like scripture too. But so for me, strong and courageous, it takes strength and courage to even do what you just said, right? the word.
Yeah.
So
It takes, I think it takes strength and courage just to show up as yourself every day. That in 2020, being a woman and showing up as who you are and not showing up as some vision of perfection that society wants you to be or tells you have to be, or your work environment tells you have to be, that takes a lot of courage, just showing up as who you are. So I don't think it's a, that's why I called my company, why I named my company Brave Enough, and why I named this whole movement Brave Enough. I'm not saying be like radically brave. I'm saying just be brave enough for today. That's enough. Like, just be brave enough to get through today and show up as yourself. That takes a lot of courage.
Well, and that, now that I've gotten past not just passed through whole book and dog-eared and listened to your stuff, I get the brave enough, because that's what I didn't get at first. I was like, what does she mean brave enough? I've got to be all out there every day, or else I'm going to get trampled. But you're so right. It's not like you run a marathon full out every day. You just take the next step. Brave enough, right?
Yeah.
So how does that manifest day to day? Give me an example of Sasha being brave enough at work or something.
Well, I think that there's many times where I will be at work and I will be required to, what I call, come out of the dugout, or, assert myself or take charge or speak authoritatively in a situation. And I know when I do it, it's going to be a little contra, how society or how the room or how anybody expects me to act.
Right.
And I will say, even, I'm about to take charge of this airway, or I'm about to take charge of this code. I'm going to be giving orders to everyone. It doesn't mean I'm upset. I'm just giving orders. And that leading statement kind of puts everybody at ease. But then what happens is, many times the opposite is true. So maybe, I will be with a patient and I'm really emotional because they're very scared, or I'm tearful or something, or they're tearful and I'm getting tearful. And before, I would be like, I can't show any emotion, because the minute I do, it's going to be like sharks in the water, smelling blood, like a sign of weakness. And now I'll just, what really the difference now is that instead of going home and doing the replay, like, oh, I shouldn't have cried, or I shouldn't have been so stern, or maybe I should have apologized for my authority leading the code, I go, nope, no, that's who I am. I'm not going to beat myself up at dinner tonight when I'm sitting there talking to my family, or when I'm laying in bed at 3 a.m. and go, well, should I have done that? Because see, that's what we do as women. We like carry our authenticity home with us and go, was it okay? But so that's one thing I've done. I've stopped beating myself up for being who I truly am. And the second thing I think is so important is when other women in the workplace are leading as authentically as they are. So maybe they're taking on roles or assertive behaviors that they normally don't have to do, but for whatever reason they have to in that scenario, I affirm them.
Yeah.
I don't have to be their best friend to affirm them. I'll say, you actually are an expert in this. You seem to be really passionate about it, or you know what you're doing, or thank you for leading, or thank you for speaking up. I affirm other women because I want everyone in the room to know that it's okay. It's okay for a woman to take charge. It's okay for a woman who's normally quiet in the workplace to suddenly be passionate about something and speak up. It doesn't mean she's emotional or getting upset. It means she's passionate about something.
Right. Well, and tell me, once you started doing that, because you had been at the same place for a little while, what was the response? How did the men respond? How did the women respond? Did they say, it's a brand new day? What's up with Sasha?
Yeah, I think so. I think that it's important to note that, I think that you and I probably both share a similar approach, that we can be perhaps a little more assertive or in our tone or in our leadership style than maybe a woman who just graduated from fellowship or just started in a company. And so I think there is something to be said for being senior, but I will say that the reaction to men, men watch women, especially how women interact with other women. So it's really interesting because it's almost like they're like, oh, what's happening here? Are they going to get in a cat fight? Or is this like one powerful woman against another powerful woman? And and it's because our society has this kind of perpetuates this myth that women are meaner to women, or they're mean to each other, or they're competitive with each other. So I think men kind of watch and they kind of, see what's happening. I know that women especially, I mean, I've had women email me a week later and say, I really learned from that, watching you handle that situation. And I thought at the time they were really quiet, and I thought, oh, I bet I offended her. And I've had positive feedback after women have like emailed me and said, I really learned from how you handled that. Like I didn't know, I was so stunned at how you, spoke out and said, look, I'm taking charge. If I give orders, I'm not upset at you. We're going to do it this way. I'm in charge. And they're like, that worked. I've never seen anyone do that. So I think it's something that, at first maybe I would get like looked at like, what are you doing? What are you taking, over? But I think it works. These leading statements work, and we can slowly change the culture when we embrace strong women and we embrace their style of leadership, which is different for every woman.
Well, and I think you're right. And I think being public about it, as you have just described, not just taking somebody aside and saying that was great, but publicly acknowledging, it amplifies it so much more, especially as you as a strong leader, then it gives them cover, if you will, for when they want to do it, because they've seen someone do it. Someone said to me recently, I shouldn't say how recently, but in the not so distant past, well, the backdrop is I just moved from the north to the south, and even though Atlanta is very cosmopolitan, it's still culturally very different. And so I recognize that sometimes my normal approach, or even my normal tone, that I just brought with me from University of Pittsburgh, was different enough than from what people heard that I needed to actually start saying something that sounds silly, but it's just being the truth is, listen, I'm about to do this, but I am a, I didn't say aggressive, assertive woman from the north. So not only did I say, I'm about to say something, but I'm like, and by the way, this is how we did it up north. And it used it a little bit, but I got the funniest comment. Someone, of course, it was a guy. He said to me, because they had done a search to bring someone, and they saw, he said to me, I thought by bringing a woman, it would be different. Like, I don't know what he thought, that you bring a strong leader, if you bring a man, it's going to be one way, but God, he thought he was going to get a Pollyanna or something, and he was shocked and dismayed that I was direct. It's just interesting what the expectations of women, isn't it?
It is. It's very interesting. And, I remember one time when I said, I'm going to take charge. If I speak assertively, I'm not upset. I'm not angry. I need your help. Like, I need it fast, and I remember afterwards, one of my male colleagues who was in the room to help me as a backup, he said, why did you do that? Like, you don't need to say that. And I said, no, you don't need to say that. You say that. I'm like, you don't ever have to say that, because you're a man, and being assertive is actually seen positively by both your peers and other leaders.
Yes.
But when you're a woman, it is not the same, especially if you are in a room where there's a power differential. I said, so I have to say that. You don't have to say that, but I do have to say that. And he was like, oh, I'd never thought of that. He's like, I just thought that was weird. I'd never heard you. I don't know why you had to say that. I'm like, because it's another layer of responsibility that you've never had to have, because it's assumed that you're going to be assertive because you're a man. So I think it's really interesting when we educate our male allies and colleagues too. Several of them have just never thought of it. It's not that they go to work every day and they're like, we're going to keep the women down. It's just that they've never had those experiences.
No, I agree with you. You're surrounded by men, as I am at work, and it doesn't have to be dichotomy. I'm not their enemy. We're truly colleagues. It's just different. But when you're in an academic place, and so you have residents and fellows all over, and they're learning from you, and you're deep in your career. And how do you help them be their authentic self as a junior and be respected, be respectful, and not, just, I mean, it's such a fine line, and especially not even in medicine, but business, right? You're a junior person. How do you be authentic and respectful? Or am I even saying it right? What is that?
No, I think that's really true. And I think it's interesting, this concept that if you're being authentic, you're somehow being less refined or less kind. Because I think that we attribute honesty or directness to harshness or an authenticity, which to me, I really, really appreciate people who are direct. I really struggle with people who are passive aggressive or want me to read, but oftentimes I don't understand what they're trying to get at. Like I love direct communication, which I think is why I love being a cardiac anesthesiologist, because we have to communicate with the surgeons one-on-one really closely. And I love that, actually. Right. So I think one of the things that I've tried to do is to empower junior colleagues, especially junior women, to find their own voice and find their own style of leadership. And that's different for every woman, but there's always a time where you have to speak up, in whatever your job is, whatever your role is, because many times you have an idea or you have innovation or creativity that you need to share around the table. And that requires having a voice and being confident in yourself. And so I always, try to teach the women that I'm training, never feel afraid to speak up to me or speak up to another, a colleague or the surgeon or anyone in the room, or even the nurses. Sometimes trainees are really afraid of the nurses, and like you have to learn how to advocate on your patient's behalf, or you have to, if you're in business, you have to learn how to share an idea or share a new, way to improve the bottom line. And that your idea may be the best idea in the room. It just happens to be in your brain, and you may be a junior, but you have to learn how to empower your voice. And so I think that we have to really encourage people to have their own authentic voice in whatever style of leadership that is.
And it all returns to that authenticness and knowing yourself enough to know what that is. Not somebody else's idea, but it's the hard work we talked about before.
Yes. Well, and it doesn't come just naturally. I think it's something you have to work on, don't you? I mean, over your year to year.
Oh, of course, because and thinking about talking to you tonight, I was reflecting on the fact that when I was a medical student and a resident, and it's for those of you out there that haven't gone our pathway, it is no cakewalk. And I was thinking to myself, I had gotten to the place where I physically said, I am a rock, I'm an island, I don't need I've got this, I'm tough enough. Because for me, that was survival, but it's not who I was. It's just where I was at that time, but that wasn't very authentic. So to get back to the nice girl from Kansas who happens to actually be able to lead in a very effective way, that's the hard work you're talking about. But I want to pivot a little bit. By the end of our little talk here, I want to be able to talk about lipstick and stilettos, and that's authentic, right? I'm the same kind of person. I do all those things, but I want to talk a little bit about a word I don't believe in, because you have managed to do a lot of things too, and you talk in the book about the fact that even working women do 2.5 hours of homeness more than their partner spouses. So Sasha, you and your husband have 4 children. You have a full-time job, and you had your children very close together. And in my family, we have a blended family, and we have 5 older children and 1 little person. And I've come to not believe that there is a balance. For me, I describe it as I can only chase 1 rabbit at one time. So I chase this rabbit when I have to chase it, and then it goes. So I don't know what happens. And then I go back to academia, and I can do one thing at a time really well. That's not to say I can't keep a bunch of stuff in the air or get to 10 meetings in a day, but do you believe in balance? How do you describe this thing women do with being all things to all people? How have you done this? You have 4 children in 7 years.
I know it's been a whirlwind. Well, first of all, I don't think that you can do everything. And I think that's a myth. And I think that is some mythical, another thing that we put on ourselves, pressure as women. So I don't claim to do it all. And I very honestly say I don't do it all. There's a lot of things I don't do because I do a lot of other things.
Yeah.
So, and I also am very honest about the fact that I have a lot of help. I always say that my husband and I are not a 2.0 FTE family. we're like a 6.0 FTE family.
Mm-hmm.
It requires a lot of people to help us raise our kids and to just maintain our home and to get this person here and this person there. And I think there are phases and stages of life. And I think that the common myth is that in every aspect of your life, whether it's your family life, your professional life, your personal well-being, your spiritual life, your friends, your profession, whatever area, there's this common myth that you should be firing on all cylinders at all times, should be perfect. And that's just a lie.
Yeah.
Like there's no person on the planet that can be achieving a 10 in every piece of the pie. And so there's times in my life where I have focused on public speaking, and I have committed to public speaking for a year. And during those years, I wasn't in my best health because I wasn't going routinely to the gym. I wasn't eating the best because I was on the road. I had to really work hard to maintain any sense of family life. And my marriage wasn't amazing that year. My speaking was amazing, but other things weren't. Then there's been times in my life where I've had like the best year of marriage ever. And I wasn't writing a book that year. I didn't publish a million things. Nobody really was talking about Sasha on social media. That's okay. Yeah. So I think that there's this illusion when you have some type of public figure, success, that it means every area of your life must be successful and you must be doing everything. And that's simply not true. And I'm really transparent about that because we have enough pressure on ourselves as women. We don't need the pressure of you should be doing everything at all times. So when women come to me and they're like, I'm really struggling, I have small people at home and I'm trying to publish or I'm trying to get promoted at work. And I think, well, first of all, you are replaceable. All of us are replaceable in our jobs, but none of us are replaceable to our family and our people that we love. So I always say you should give your family the best, and your work the rest, and then maybe choose one thing a year you want to accomplish, like one thing, not 10, and maybe 1 year it's your health and well-being. It's very hard to really get your health and well-being in the right spot if you're also trying to do all these other things. So to me, it's there's stages of life, and give yourself grace in every stage.
And that's so important, the whole concept of grace. And you said it another way. You said it's okay not to be all at all times. And that's really something that I have found myself historically. I turned 50 a while ago, and it finally dawned on me, and when I turned 50, I made a list of everything that had happened in the last 15 years. And I'm like, wow, on paper, I don't have to feel striving anymore, or I don't, there's some peace that came with that. But I love what you said about you're not a 2.0 FTE family, and we're not either, actually. And if you get Sasha's book on page 191, you give examples of things that you can outsource. The out list, right? I mean, cleaning and laundry. The number one thing I tell young residents, if you have 2 nickels to put together in residency, get somebody to come and help you once a month because you get one day off. Do not clean your house, right?
Right.
List that. Home organization, meal prep, errands, any little thing that is a peripheral thing in your life. If you can possibly give up a cup of coffee and afford somebody to help you, what a good way to extend yourself. I think that's so important that you've pointed it out here.
Yeah. No, it's true. And a lot of times we think it means hiring like a full-time housekeeper / child, but it doesn't. I mean, you can outsource small things to, like you would hire a weekend babysitter to come and watch your children for a couple hours so you can have a date night. You can hire somebody like that to come in and do laundry once a week, for just so I have, I've always said that like most of the college girls in my neighborhood, I probably have clothed them because they do jobs for me all the time and earn cash just doing stuff that I need help with, so
right.
I'm pretty honest about that.
Well, I love that part. And that's such good advice, no matter what stage we're in. Something else that you're talking about in here, as I have this picture of me from residency where I'm about to go into the trauma bay, or I'm either in the trauma bay or I'm in the OR already, and I'm lifting up my mask and I'm putting on lipstick. My mask is on my face and I'm doing that. And it's always been a joke when I show somebody, or I put it on social media every few years but it wasn't a joke. I was serious. I wear lipstick under my mask because
I do too.
Yeah, right? It's who you are. But in your book, you say things like, we must accept that while working in a hospital, you can still cheer on FaceTime with your toddler. You can do both things, right? That you can cry over coffee with your work colleague and encourage her, and then head right into a boardroom and give the presentation of your life. You can, and this is dear to my heart, anybody that knows me, and when you see me at a conference, sometime you're going to say, I wear the highest stilettos that I can tolerate, for as long as I can tolerate them. And I can still put on my dirty old clogs and put so much metal in a bone, you wonder if the bone's still there, right? I mean, I love that you give examples of, these are both sides of you. You don't have to not be you. You can be you and be lipstick and leadership and formidable and feminine and anyway.
Yeah, I love it. And it takes courage to be you, right? Like whoever you are, it takes so much courage. And so we should celebrate each other in our differences and how different we are as women. I think it's such a beautiful tapestry to think about how women express their femininity in such different ways. For you and I, it's high heels and lipstick, and for other women, it's different things. And that's something that we should embrace and we should encourage, because it opens the margin for how we have to be in our workplaces. And it gives us it's like having a big collective breath, like it's okay. It's okay to be who you are at work.
Yeah. So before we bring Denise back, I wanted to talk a little bit about your conference, where, COVID kind of impacted your book, but the conference isn't until September. So tell us what you do there and who is it for? And
it's amazing. The Brave Enough conference, the first year I started it, I thought, I'm just going to see if I can get 200 women to come. And it sold out in an hour. So it was crazy. But we have about 450 women, and you can be in business, law, medicine. And it's really, it's all about you. So you come to the conference and it instantly goes internal, because we rarely do that as women. We do things to improve our communities, improve our patients, improve our business practices, and improve our kids and our spouses, but rarely do we really go to something where it's just all about our own personal development. And this conference really is. We connect you with other women, and it's it's the most special thing I've ever done in my life. So as cheesy as that sounds, it's hard for me to put it into words, but it's just an amazing experience. And I always tell women, you can come on E, you can come totally empty, and you will leave filled up. You will leave feeling like, okay, I'm not alone. My experiences are shared by other women, and now I have some inspiration and some tools in my toolkit to go home and live differently.
Well, it sounds amazing, and I think that's why I'm so exuberant about meeting you and reading your book, is because I just was a rock in an island, and So I'm going to bring Denise back, and she has some questions for you. Some popped up in the chat. So
I'm back. Hey. Hello. Loved the conversation. Hello. I was thinking about the comment that you had made about, having all these college women in the neighborhood helping you out. And I just saw this like little relay race over time where, you call upon them to help you out, and then they get to a point in their careers where they pull the next group of college women to help them out, and it just continues and it continues, just ways that we can all help each other. I just had that little vision pop in my head. So we did have a question that came in from the audience, and this is from Diane. And Diane says that sometimes when I try to speak to my boss, she half listens. I so want to say something to her. We say we multitask, but when talking to an employee, I feel her attention should be directed to me, the employee. So any suggestions taken? How can she connect to her female boss in a situation?
That's a really good question. Yeah. Well, I think that's a very, unfortunately, common thing that happens nowadays when we have our device. It's easy to look at our device and not give attention fully to whoever's we're speaking to. So I think one of the things that may work is to, when we're not getting something from someone, it's typically we really value them. So we value their time, or we value their opinion, or we value their approval. And so one thing that might work is to say, I really value just be honest and say, I really value your time and attention. So is there any way that we could sit down here for a minute and have a face-to-face? Because that might be different than like stopping in the middle of the hallway, or, stopping this person when they're just on their phone, and that may get her attention to go, oh, like this is somebody that really values my opinion and values my attention and time. So it's a way to come at the problem, maybe complimentary, instead of putting her on the defense, just saying like, I really value your time and opinion and attention, and I could really use like your undivided 1 or 2 minutes of your time face to face right now. Do you have that to give to me? Most people would see that as being a positive thing and may change the way they're communicating with you.
That reminds me of the example that you gave of, okay, I'm going to give orders now. I'm not upset, but you're just kind of setting the tone, and maybe even kind of breaking up either the flow of the communication that was otherwise happening before, and establishing a neutral kind of playing field to accomplish what needs to happen. So it's a little bit of like that, right? So I really value your time, maybe even pulling this individual to a different location. Hey, let's go get some coffee, or let's have a cup of tea and talk if we could. And it maybe might shock them out of the dynamic that they were otherwise in. Yeah. I really like that idea. Yeah. Okay. Hopefully, Diane, let us know if you have a follow-up question, but I wonder what we can do as women to celebrate more so these different leadership styles that we see. Oh, Diane says, thank you, by the way.
Oh, sure.
So you talked about how you could, send a note or pull somebody aside to say, hey, I, really liked how you did that. But is there more that we can do, some more things that are symbolic in a way that we can celebrate the great women leaders that we see kind of living authentically and leading authentically?
Yeah, I think that there's so many, they've done actually studies in the workplace, and men are so good at self-promoting. right?
Oh,
Men like, I mean, it's unbelievable. I mean, even my, I tell the funniest story about my son, but this last winter, my youngest son was at a basketball game, and went to the foul line 3 times, and he missed 5 out of 6 of his free throws. And my older 2 boys, if they would have, I was thinking like, oh, he's going to come off the court and he's going to be like in tears, and I'm going to have to like get him an ice cream cone on the way home, and he's going to cry about this, because I was used to his older 2 brothers who are really competitive. And he walks off the court and he says, Mom, did you see my swish? Like the one basket he made. I'm like, that is your response? Like, did you have the amnesia? Like, but he was so proud of the one basket, and I thought, oh my gosh, this is such like a man, like who cares, just self-promoting. And so women don't do that. Women, we do not self-promote. And, I'll hear of women that'll say, oh yeah, well, I got this thing published, and they're like whispering about it. So one of the things that I will do is I promote women all the time. Even if I don't know them, I'll retweet, repost, send an email out. Did everybody see that so-and-so got published? Because what it does is it levels all of us up. You don't have to know another woman to promote her. You don't have to be her best friend. You don't have to get together on Saturday night and braid each other's hair to promote a woman. You don't even have to like her, but it's going to help you. It's all it's going to do is help all of us. And so I think that we can amplify women, especially around, we know there's data to suggest that when women are around a table, if there's only one woman, the chance of you speaking is like 4%. If there's 2 women, the chance of a woman speaking, each of you speaking, goes up to like 60% or something. So a lot of times if a woman will start to speak, she'll get interrupted, and I'll say like, okay, I think Nancy had a really good idea about this, or Nancy, don't you know a lot about this? I would like to hear from you because you're an expert in this. So obviously it puts her up, and then it opens the door for her to talk. And I think we really have to do that, because the men in the room are not doing that for us.
Right.
That's right.
I wonder if we need like a little cheat sheet, notes that, as we go into these meetings, like, okay, remember to do that. But to think about the dynamics of the room that you're in, right? Like that,
Yes.
That seems like that would be a good idea. This is one of my rapid fire questions, but it's kind of related to this topic. Like, who do you think are there any public figures that you could think of who do this well, so that people, can think of that example and say, oh yeah. And maybe, I don't know. I don't know if, there are any that are top of mind for either of you for that matter.
That's a really good question. I think it's interesting because I think obviously the first person that comes to mind is Oprah. I think Oprah is one of the best. If you've ever watched her, there's a reason that she was as successful as she was, because she is so good at taking what someone said and like summarizing it and then amplifying it. Like you can be speaking for 10 minutes and she'll take like the 3 pearls that person said, and they could have said like 90% things that didn't make sense, but Oprah would take like the 3 things that they said and she would summarize and amplify. And I think that that's a technique that I always, I'm really aware of, and I'm like, man, I really wish I could do that. Or I try to do that to the best of my ability, is to kind of take what someone is saying. And the other thing that I've learned from my friend who's a speech coach, she always says, when you're saying something that you're really passionate about, a lot of times you start to get what is perceived when you're a woman as getting emotional or angry.
Yes.
And most of the time it's just because you're really knowledgeable at this on the topic, but everyone around you is getting nervous because they think that your voice is cracking because you're angry or emotional. And that happens to me a lot of times. And what she says is you just breathe through it, but you also call it out. The leading statement helps in that scenario too. So I'll say, I'm going to get really animated right now because I actually am an expert in this. And everybody goes, oh, okay. So I say, if my voice cracks, I'm not angry. I'm an expert in this. I know a lot about this because I've studied it. And it gives you a platform, instant platform and credibility. It may sound arrogant at first to you and feel uncomfortable to talk like that, but it's probably true. I mean, think about it. If you're going to say something or speak up, you probably know the most about it, right? So believe in yourself and be confident and just say, like, I'll just say, I'm going to get animated and I may talk a little fast right now, or I may get a little excited because I'm an expert in this. And everyone goes, oh, okay. And they're okay with it.
That I can think of a very specific example of a meeting that I was in. And again, it's a subject matter that I knew very, very well. And I thought that I was rather calm and not reserved about it necessarily, but one of the individuals in the room says, I can tell you're upset. And I'm thinking, upset? I'm not upset at all. Like
and then you get upset because they think you're upset.
Well, and I'm like trying to backtrack in my head. What did I say? I'm thinking, no, I care about this a lot. I know an awful lot about it. And we're, in some cases, maybe we're missing the mark in what it is that we're doing. And I'm trying to steer us back to the right thing. But it's interesting if I had said, this is a topic that I care a lot about. This is something I have studied quite a bit. I have, a lot of great ideas to share about how it should work. So you're right. I mean, I think that would help level set and maybe even neutralize, a perception that someone had, which I do think was a little off mark, but nevertheless, that's really good feedback that I've got to learn how to fold into kind of my daily conversations. Back to the talk about, there's a season for the things that we do, and it's okay to say no to certain things. How do you strike the right balance between, okay, I've said no for a really long time, I'm aching to do something more. How do I break free of a rut that I'm in to go for what I want? How do you kind of coach yourself in that situation?
Well, I think that it's really good to recognize it, and that one of the things I've had to learn is people are not mind readers. So people don't go, I think it's kind of a false belief that we have that our leaders come to work thinking like, how can I promote Sasha? Or how can I help Vonda today? Right? Or or I wonder if Denise is ready to take this next level. Like, our leaders don't come to work thinking of that. So we may be thinking of that, but we have to be really clear and promote ourselves and our wishes for our own careers. And I think women work harder than everybody else and expect somebody to notice. And that just doesn't happen.
Right.
So I've had to learn this about myself. Like, I've seen roles go to people that I'm like, are you kidding me? I'm 10 times more qualified, but I never said I want that role. And when it comes open, I want to be the person that goes up for that role, because I was just doing all the work thinking I'm going to get noticed.
Surely
I've done more work, and that's not what happens. Right. So I think we have to be really brave and courageous and say, I'm ready for this. I want this, or I expect this in a year, or I'm going for that. So I want you to know and have me on your radar. And there's nothing wrong with doing that. Like, what the worst that's going to happen is you won't get it. Well, you probably won't get it if you don't say that at all either,
Right. Yeah. Your chances are zero. If you don't go up to bat, like, your chances of hitting a home run are completely zero. Okay, just check and make sure if we had any other questions that come through. So a little bit of a rapid round here. What is your inspiration for this work that you do? Moving forward, is it your colleagues? Is it your family? Like, what really kind of drove you to be vocal about this? To share your experiences.
Well, I think that there's two things that motivate me. The first is my daughter. I have 3 boys and 1 girl, and I hope that someday my daughter has more opportunities and she gets paid the same amount as any of my boys. And that when she speaks, people listen, because she's pretty special. And I want her to not have the same, bias and discrimination that I faced in my career. That's number one. And the second thing is, there came a point in my career where I thought, there's a lot of people that can give anesthesia, and I love giving anesthesia and I'm really good at it. but there's only one person, there's only one Sasha that can share her voice. And I thought, do I want to live my life? What do I want to be living my life for? And it's not that having a voice means I'm not a good anesthesiologist. Two things can be true at once, right? Like just both of you, one of you is a surgeon, one of you is amazing, CPA, you both have careers, but you also are doing something to help other women. That's what I want to be known for. That's what I want my legacy. And I don't want to have regrets and look back and go, well, I wish I would have wrote a blog, or I wish I would have spoke at a conference once or something. So those are the reasons that motivate me.
Wow. What's the criteria that you use to say no to certain things? How do you make that decision? And how hard is it?
It's hard. I think now it's harder than ever, actually, because when you're starting out, you say yes to things so that you may not want to do, so that you can say yes to things you eventually want to do. And then as you get successful, you have to start saying no to things that you actually want to do, because they will stop you from doing things that are just like totally amazing, right? So like now I have to say no to a lot of things that I actually would probably love to do, but I just don't have the time, or it doesn't fit with my plan. So I'm very specific. I have a 3-month plan and a 1-year plan and a 3-year plan. And those change frequently, but I have very specific goals. And when someone asks me to do something, as amazing as it might sound, if it doesn't fit in those goals, that's my filter. So I have to do that for myself, because if I don't do that, then I say yes to things, and then some amazing opportunity that does fit with my goal comes along and I'm too busy.
Yeah. That was one of my follow-up questions is, what kind of time horizon do you plan out, like what you want to do with life? So I guess my follow-up question, since you did mention, the timeframes that you use, is it constantly rolling, or do you have a 3-year plan? And as you knock off those things, for 3 years, do you allow for spontaneity if there's something like truly amazing that shows up?
Yeah, I think I do. And that's why I have my 3-month goals. I think my 3-month goals change quite frequently. I do something, I talk about it in one of my podcasts. I do like a self-retreat about once every 3 or 4 months, where I kind of sit down and I reevaluate my 3-month, my 1 year, my 3-year, because it changes. You change. It should change, and sometimes I go through something and I learn a lesson or a challenge or a failure that I thought, oh, I really want to do this thing. I've always wanted to do this thing. And then I go, why did I want this? I don't even like this thing. Mm-hmm. So I think it's good for us to have like a little self kind of, whatever you want to call it. I call it my self retreat every few months, and ask yourself really hard questions. Like, why am I doing this? The why. It's all about the why, because I think your why will change as you change and grow.
Right. Simon Sinek talks about your why. Why are you doing it?
Sure.
Is there like a special planner or device that you use to kind of prompt your thought?
Yeah. Well, I love the Passion Planner. I'm obsessed with the Passion Planner. I have one. So that's what I use. But I've read a couple different books about vision, having a vision, and having a vision script and a vision for your life. And that's very different than having a mission. So mission is like what you're doing today, and a vision is like what you want to be known for and what you want to leave your legacy. And so I think that as I write my goals, it's really easy to put your head down and like be in the now and do all the work, the tasks, but that's not really vision. That's not like what your goals should be. So my 3-year goals are definitely visionary. They're definitely big stretch goals and a little riskier, and I may or may not achieve them, but I try. And I really like books on that. Michael Hyatt has a recent book about the visionary leader that's a really good book, and it talks about how to do a vision script.
So that's actually a good lead into one of my questions, like a favorite book or a favorite podcast, that you listen to for inspiration, for guidance.
Oh gosh, I'm kind of I love podcasts. I love the podcast, How I Built This. I don't know if you've ever listened to it.
Great.
Have you listened to how I Built This? I think it's so interesting how people just got to where they are. Like, I love stories. I love storytelling. So that's one of my favorite podcasts, is How I Built This by Guy Raz. I think he's a great, he's got great interview skills. So that's one of my favorites.
Okay. Let's see here. I think I just have one final question for you. So what sort of advice would you give to your younger self?
Just to be kinder to yourself. You know, the person you're going to be with for the rest of your life is yourself. So I think I wish I would have been a lot kinder to myself and not so hard on myself. I think we're all very, at times, self-critical. And I think I was really critical of myself for so many things that I messed up along the way. And I wish I would have given myself more grace.
Grace. How about that? Yeah. Yeah.
Well, Sasha, thank you so much for taking this time. I mean, I really appreciate it. And I can't wait for my staff to have your book. And I'm thankful. Thank you for joining us.
Thank you. Thank you both for having me.
Yes. Thank you.
All right. Farewell, everyone.